The CDC has recently released data that shows racial disparities among people who are at risk for HIV. There are highly effective HIV prevention drugs on the market called pre-exposure prophylaxis, or PrEP. It's about 99% effective in preventing the contraction of the disease through sexual contact. But only a handful of people at risk for the virus are taking them. The Centers for Disease Control and Prevention says that 94% of white people at risk are on PrEP, but less than 13% of black people who could benefit from the treatment are receiving it, and less than 15% of women are taking the medication. The cost of the medication, doctor's visits, lab tests, they could all be more than $5,000. But now there is a lawsuit that may let employers deny coverage for religious reasons. To take a look at your options, let's check in with the good doctor. Joining me right now is one of our faves, Dr. Bayo Curry-Winchell. She's an urgent care medical director. Doc, good to see you. Why isn't this treatment for HIV being talked about more in communities of color? I'm old enough to remember the 80s when there was a pandemic, a crisis. People were dying and there was nothing we can do about it. And now there's PrEP, and there's a lot we can do about it, and it's not happening. Why?
It's multiple things. Number one, when we talk about trust in communities of color, we need to invest in understanding how PrEP can help, but also sharing the information to those communities of color. And unfortunately, like we know, medications, access, all the things that are important to us as a Black community often are left at the cost of healthcare. And so as we talk about HIV and PrEP and the ability to really prevent such a disability, like a debilitating disease, we have to talk about this ongoing lack of understanding and being able to access this important medication.
Unprotected sex is just one behavior that puts people at risk for HIV. How is the medical community keeping HIV prevention at the top of mind for people of color? When we think about other ways, one of the most common, of course, is needles.
So the first thing when we take a look at the fact that when we look at commercials for PrEP medication or the access points of getting HIV, you don't often see communities of color at the forefront. And so when we don't have that piece of information, it's hard to be able to think about what can we do to prevent getting HIV. And so being able to be in communities of color, having the ability to ask questions about HIV and get treated is so vital in all communities, but especially in the Black and brown communities.
They're cheap, easy to get. In some cases, they look like candy. But parents are now being warned that these things could be dangerous. Let me tell you what I'm talking about. Delta-8 THC products come in gummy and vape form. And the thing is, you can buy them at a gas station. You can get them at certain convenience stores. They're not regulated, but still scientists are concerned about risks. Risks to your brain and its development, risks for addiction, risks for accidental overdose. Doc, it seems to me that with Delta-8, we're getting a false sense of security that everything's going to be okay because it's not the quote-unquote bad stuff. Am I overreacting here?
You are not. There's this false security of thinking that it's hemp, that it's natural, that it's organic. What we're forgetting is you can be hospitalized. And unfortunately, if you have underlying health conditions, this can actually cost you your life. And so the fact that these are accessible in all areas, this is causing, ongoing inequities and disparities already present in the Black and brown community.
Oof. The CDC says between 2019 and 2022, they identified thousands of cases where kids ages 5 and younger were taken to the ER after ingesting melatonin. Doc, parents are trying to regulate the kids' sleep cycles. Are there healthier ways we can do this than giving people stuff that can get them these kind of outcomes?
Yes. Studies have shown that the amount of melatonin in those gummies is not regulated. You can have a high amount or a low amount or none at all. So what I recommend to my patients, and I do in my own household, is create a routine around bedtime. Find out those things that can really help you fall asleep other than medications.
Right. We can't just medicate our kids into all of our solutions. I appreciate you for saying that. Dr. Bayo Curry-Winchell, thank you for your insights as always.